to our last plenary of the day. We're going to have a plenary session followed, as we did yesterday, by a brief daily wrap-up. We've invited some people to join me on stage to share some reflections about the day, so I do hope you will be able to stay for that. But in this plenary, we're going to talk about cutting through the noise, the role of public health experts in managing an infodemic. And this, as we heard, for those who attended the Euro surveillance seminar earlier, where we heard about some of the challenges that COVID-19 has posed for public health communicators in the rapidly changing environment of public communication. So in this session, going to focus very much on that and the role of public health communicators and institutions in building public trust and promoting scientific literacy. Don't forget, if you have any questions, please do put them, live discussions, question box, in the questions, brief as you possibly can, and we'll try to relay as many of them as we can to the speakers. I'll be monitoring what's coming in, and hopefully we'll have time to take a few. But let me now hand over to the moderators for this session, escaide Scientific Committee members Petronille Bogaert, Head of Unit in for EU Health Information Systems at Sciensano in Belgium, and Mircea Ioan Popa, microbiology professor at the Craiu Davila University of Medicine and Pharmacy in Romania, who is joining us remotely, and John Kinsman, expert in social and behavior change at the ECDC. So, over to you, team. I'll let you introduce your own speakers.
Thank you so much, Jackie. So welcome, everyone. Thank you so much for joining us for this next session, Cutting Through the Noise, the Role of Public Health Experts in Managing an Infodemic. So indeed, we've already talked a lot about communication in the sessions today, and I'm very glad that this is an important topic to discuss. What we'll be discussing further now is really looking at the experiences from the COVID-19 pandemic on challenges with regards to this public health communication for experts. Because as you know, the COVID-19 pandemic led to a rapidly changing environment for public communication. Of course, there's the influence of social media, but also the increasing polarization of public perception and debate. So this session will explore how public health communicators and institutions can best contribute to building public trust and promoting scientific literacy by identifying skills and systems needed to effectively prepare for and respond to infodemics and handling misinformation. So we will be discussing resilience approaches on how these are effective in building trust, promoting scientific literacy, and countering misinformation. And we will also discuss why it's important for you, so those joining us virtually, but you sitting in this room as well, to use resilient approaches and how you can do that. So now Mircea will introduce our speakers.
Hello. I would like to introduce our speakers of today. First, we will start with Neville. He is a lead of the Directorate Health Information and Statistics of the Ministry of Health in Malta. Alma Tostmann, she is a Deputy Head Infection Prevention and Control of the Radboud University Medical Center in the Netherlands. Mihai Craiu is Professor of Pediatrics in the Davila University of Medicine and Pharmacy in Romania and in the National Institute for Mother and Child Health. And we regret that Martina Bilciuchevich is not here today, but she contributed a lot to this plenary. She's the head of the EST Strategic Communication Task Force in the European External Actor Service. So, John, the floor is yours.
Thank you very much. Excuse me. So it's a real pleasure to be here this afternoon, and thanks to our fantastic speakers for joining us on this important topic. Before we sort of get going, I just wanted to spend 2 or 3 minutes just giving some thoughts about some of the concepts we're going to be talking about. Misinformation, disinformation, infodemics, because they're quite widely used words, but perhaps it's good if we have a sort of baseline understanding of what it is that we're talking about. I think we all recognize that these things are a huge problem, so let's just at least I can give my thoughts on what these are. Misinformation we could describe as information which is false and misleading, which circulates often online or not, as the case may be. Simply that. Disinformation would be potentially the same idea, but it is spread with intent to confuse. So there's the distinction between the two, and I think that's important that we recognize that. The actual information is the same, but the intent of spreading it is different. So misinformation can become disinformation. Somebody could say something which could then be, as it were, twisted deliberately to cause confusion. But similarly, disinformation can become misinformation, because you could be subjected to that sort of information, you think it's correct, and then you spread it innocently. This is important because it doesn't make any difference, therefore, if we're trying to look at dealing with the information itself, the strategy will be the same. The strategy for dealing with the source of the information will not be the same. And that's an important distinction that we make. Obviously, we're talking about health literacy. What does this mean? It's basically, I've just got a definition here, which I think is quite useful. It's the ability to have access to understand, to validate, and then to apply health information in order to take informed and appropriate decisions in everyday life concerning health. So essentially, it's how we take the information that we receive and we apply that. If we then talk about this in relation to vaccines, vaccine literacy, it's exactly that same concept, but specifically applied to vaccines. And what we want is for people to be vaccine literate so that they can be resilient against misinformation or disinformation. How do we do that? We promote vaccine literacy, and this will be, of course, one of the things that we're talking about. We can debunk information which is out there. In other words, we can find a piece of misinformation and we can directly target it, and we can try and explain why it's wrong. We can also pre-bunk information. This morning we were hearing about the AstraZeneca problem earlier along in 2021. We could definitely see that there was going to be misinformation circulating about that. So we could try and change the narrative into something which was slightly under our control. Of course, it didn't really work, but this is an example of where you can see how you could try to pre-bunk potential misinformation. And then there's more sort of conventional issues to do with health literacy, science literacy, digital literacy, and so on. So that's just a short introduction to some of the concepts. For anybody who's interested, we recently published in June what I think is a really nice e-learning on addressing online vaccination misinformation. So you can find that on the ECDC Virtual Academy, or EVA. And I strongly recommend it. It's a 6-module course. It's self-paced. You can take it at your own pace. And we've had quite good feedback. So if you want to follow up, please go ahead. That's a place to start looking. So there's some of the concepts. I'm now going to hand back to Petronille. Over to you.
Thank you so much. So I actually will invite Alma to talk about our role in explaining epidemiological concepts and providing updates on the COVID-19 pandemic in the media. Go ahead, Alma.
Good afternoon, everyone, and thanks to the panel to invite me to speak here on this year's escaide edition in Stockholm. So the first time I attended this conference was in 2008 in Berlin, before I did my EPIET fellowship, and I feel very honored to be here now in a plenary speaking about my work that I have pursued after the fellowship mainly. I will be talking about my personal experience I had during COVID. I'm an infectious disease epidemiologist working in a hospital, and the times have been hectic. They have been very inspiring, and I learned more in the past 2.5 years, I think, than I did in the many years before. And I will take you on my journey. So, as an epidemiologist, I ended up working in the hospital. It's a bit uncommon in the Netherlands. Usually an IPC unit has a medical microbiologist as a head, that we also have in my unit. And then there's a team of infection prevention experts. And in my team, in 2019, they decided to hire me, and I share the management of the unit with the head of my unit. And the day-to-day focus of our work is to prevent infections in the hospital from spreading from one patient to the other, or via the environment, or via healthcare workers. I have a lot of contact with all kinds of people in the clinic, but also outside with the RVM, the Public Health Institute, and also internationally. And my main role for my position is to conduct surveillance of healthcare infections, I do a lot of teaching, I do a lot of applied research, and all of the things I've done before I started working here actually come together in the job that I'm doing right now. So then 2020, COVID hit. Well, being in an IPC unit in a hospital meant that that we were actually already preparing from the first rumors in January onward. So updating the list of PPE that healthcare workers should use. But then from the moment the first patients were admitted to our hospital, well, the team became not chaotic, but it became very, very busy. Luckily, we had some support staff, and there was a lot to manage for me, also with hiring the support staff and making sure they had things to do, they were instructed and cared for. I became a member of the hospital outbreak management team. I set up healthcare worker surveillance and conducted applied research. And in April 2020, we published a paper on early symptoms in healthcare workers, focusing on headache and general malaise. And that was one of the things we did in those very hectic early months of the pandemic. So in the summer, things calmed down. Some people thought it was over. Of course, we didn't think that, but we at least could take a little break. And the National News Agency of the Netherlands decided to use that period of calm to contact all the university medical centers if there were maybe other people to appear in the media, because there had been a lot of ICU doctors, microbiologists at the talk show tables, and I wanted to see if there were more people with expertise who could maybe also be invited to explain what was happening. So that's how, through the communications department, they came with me, we had a chat, and I said, oh, well, your expertise sounds relevant. Would you be interested in maybe being interviewed on radio or TV one day? And I said, well, okay, why not? Actually thinking I would never hear of them again. But little did I know, and then the day before my 40th birthday, I had an interview on the radio, because then cases were starting to rise again. I was super nervous. I actually wanted to back out and let my boss do it. And he said, well, you're nervous, so what? Just do it anyway. And actually that was the motivation I needed to go for it. And then after that followed a lot of newspaper interviews. And then within a few weeks' time, I had my first explanation appearance on the national news, talking about COVID and epidemiology. So the things I felt I could contribute, and that's also what I said on that first phone call, is that I could talk about basic concepts, general concepts of infectious disease epidemiology. So that, for instance, if the measures take effect and the infections go down, it's not because we're overdoing it, but actually because it's happening the way we wanted it to happen. The concept of exponential growth was an ongoing topic in the questions and the discussions. Of course, a lot of misunderstanding and confusion about the concept. And I've seen it in the Netherlands. I'm sure it has been similar in other places where, of course, you could already see infections going up, hospital cases going up, and then the response would be, well, we'll just see how it develops. It probably stays like this. And it happened a few times that, of course, infectious disease epidemiologists, public health people really started to worry, when things were still calm. But then, well, how it ended, we all know. And then, of course, the vaccination and communication around it was also something I had some colleagues also who were also interviewed quite often, felt we could really help out by explaining that, okay, a vaccine does not protect you 100%, but still is worth taking it. We had, well, I can tell like hundreds of stories, but one of the stories in the Netherlands was that young people were persuaded to get vaccinated. They would get a vaccine in the afternoon, and then in the evening they could go out dancing with their brand new QR code. Of course, that doesn't really help you. Help you to prevent any transmission, because of course you need 2 weeks for the vaccine to do that for you. So that was the beginning of our big Delta wave that started in the summer of 21 and continued all the way to Christmas. I think working in a hospital gave me and also the colleagues who also did similar things quite a neutral position, because we didn't make the national policy. You work at an institute that has knowledge and expertise, so you have the authority to also talk about this topic. But then from the neutral position that you are not part of the decision-making process. So that gave us also a bit of freedom to not necessarily to comment, but at least to sort of reflect a bit wider and to also explain a bit better why some things were going this way, and we actually always went back to those basic principles that were quite often the underlying question when we were approached. I got quite active on social media doing the same thing, so talking about basic concepts, explaining epidemiology. I quite enjoyed it. I actually started Twitter only when the pandemic started, but I thought it was quite fun, despite of all the negative harassment and those things I will talk about later. And I think one of the things that really helped me, and that's also something Isabella referred to in the Eurosurveillance seminar on communication, is that it's really helpful if you have support. So my institute is quite big and we have a really good communications office, and they helped me with all the logistics around media interviews, but also we formulated a strategy like, if you are a hospital, what is your position? What do you want to talk about? What is for us? And also what is not for us? So quite often we got questions and we thought, well, this is really, really something you should ask the Ministry of Health, or you should ask the public health agencies. And they would not always respond to those requests, but at least we also try to keep our boundaries to really keep feeling secure that whatever we would talk about would really fit our position. I got a lot of support from my head of department, my colleagues, also for their expertise. If I needed to know something like very quickly, there was always someone who would help me. And I think also on the home front, you need a bit of support. So my husband, he quite often rolled his eyes when I said, yeah, tonight I'm going to the TV. Okay, again, yeah, again. And he took care of our kids. But you need, of course, support on all kinds of levels, because then, yeah, you're not feeling alone. And I think the consistent, clear and polite messaging was always the approach. And for me personally, the motivation was really that I felt I was given an opportunity to really contribute to public health in a way that not everybody was able to do. So I took it really seriously. And I always followed the line to support the national policy and try to be as constructive as possible, and always remains, or almost always remains, polite. So then we go back to 1 year ago. So we just came out of the second summer of COVID, where things had calmed down again. We had this QR code, people could go places again. There were still basic measures. They were not really emphasized that much, but they were still there. And most people thought, okay, we can go back to normal. So then October came and there was an increase in cases and hospitalizations. It was still not really noticeable, but we really started to worry because of the exponential growth concept that was still valid. And me and also other colleagues in the country started actually sharing concerns in the media, because the official objective of the national strategy was still to, well, keep hospitals open and accessible, and to prevent, you know, big influx of COVID patients. So my reasoning was, okay, if that's your objective and you want to prevent full hospitals, now is the time to really up your gear and do a bit more than you're doing right now. So that's why we also took it quite actively to talk about this. So the photo you see here, I was on a small holiday with my family, and my husband again rolled his eyes that one evening I went to the media park for a 5-minute interview, and then I was brought back to our holiday place. So yeah, that was a bit of commitment. And then it became November, and I was actually yesterday evening scrolling back through a lot of messages we shared in that time, and the hospitals became fuller, not only in our country, but in many other countries. And the confusing thing for many people in the public, also I think for politicians, and I think also for many health professionals, was that many of the hospitalized cases were vaccinated. Of course, that was not surprising at all, because we knew the vaccines would not protect serious disease 100%. But it was really confusing to people, like, we were promised freedom with the vaccines, and why do we see these people ending up in hospitals? And I got really confused that I thought we were going to prevent full hospitals, and I thought, well, then you should really look at infections and try to get your infections down. And the tendency was that you just wait to see how the hospitalized cases would develop, and only get into action if the hospitals were actually full. Well, of course, then you're too late. The code black scenarios were taken out of the cupboard again, and they were being discussed nationally. They were the scenarios were actually being trained also in the hospital where I work. And code black means that if you have scaled down all the healthcare that you can reasonably postpone, you still don't have enough capacity to actually accept all the acute patients. So that would mean that you have patients coming in, there's not enough room on your ICU, so you decide who to admit and who you will send away, well, basically to die. And the fact that Code Black was really within reach, well, in the second COVID winter, was really frustrating and stressing us out. And then the communications department of my hospital decided to make a film. And it's like a YouTube film, like maybe 1 minute long, with the message, really someone, and of course it was directed to the government, close the tap, because we cannot use or cannot buy a bigger mop to clean up this huge amount of patients. So this video went viral, which I felt was also quite funny because I had never expected that to happen to my career. But it was really serious and we were super stressed out. And yeah, I cannot believe this was already a year ago. And still not so many measures were being taken. The basic measures were being re-emphasized, and the main message was to the general public, well, you don't really comply to the basic measures, so it's your fault that this is happening. It was really confusing. So then it came December. Early school closure had been on the horizon for many weeks already. It had been a topic of discussion. The minister had previously promised never to close the schools again. But there he was at the 14th of December announcing that they will actually still, that they would close the schools 1 week earlier for the Christmas holiday. So Monday 14th of December, of course it was super short notice, he also admitted that. And then he said, well, if you need the Monday, because it's such a short notice, you can stay open on Monday, because I feel really bad for the schools, because they still have to close. Well, then I thought that's not really the best idea, because the Monday for Christmas is like one incubation time away from the Christmas dinner table. And if the children pick up an infection at their last day in school, they will definitely give it to the grandparents. And that was the whole thing that we were going to prevent. So in my mind, this would really undermine the whole plan. So this is one of the moments where I felt not really rage, but I was really, really frustrated. And this is one of the only times I became quite vocal and explicit. And again, I was given the opportunity to discuss this measure on primetime Dutch television. And yeah, where I said, well, this leniency Monday would really undermine this whole plan. So it's the worst idea. Really, schools, please don't do this, because then the whole thing is worthless. And I really felt quite satisfied that I heard back later through, well, whatever people I know, that quite some schools actually decided not to use this Monday opportunity because they heard this, this message in the news. So I thought, okay, this is something I would really call having an impact on public health. There were tons of challenges. I was also really impressed by the talk of Isabella in the Eurosurveillance seminar, so I recommend you to look at her long list of challenges that she mentioned. Actually, I recognized all of them as well. But I think I wanted to focus on specifically is that quite often I was asked to sort of reflect on policy changes of the outbreak, the National Outbreak Management Team, at a moment when the whole documents were not yet published. So that was the whole sequence in the Netherlands. The measures would be announced, but only the next day they would publish the PDF document with all the explanations. So that felt a bit strange, and actually I quite often thought, okay, no, I don't really want to talk about this, because if I'm not sure what's in the document, I cannot answer these questions. Also unexpected questions, people take up a lot of space. Also threats like you're part of the propaganda machine of the government. So my solutions to these things were actually just, you can prepare for all of this. You can prepare for these questions, and people who harass you on Twitter, you just ignore and block them. I think there is definitely room for people in public health, but also maybe working in other institutes to really help support the main message. And I really believe in the concept of one message and more voices, because the demand is too high, and I don't think we should sort of give in to the entire demand. But I think it's really important to, as a scientist or as a medical doctor, you signed up for helping society, and I think this is a way that you can actually contribute to public health and to society. So my take-home message, and this is also something that was broadly discussed in the Eurosurveillance seminar, is that I think we need well, I think we need more people, more public health people, but also more women and their voices in the media. Women, I think, in general tend to be too modest. They would say, I mean, it's the thought I had myself, well, I don't know so much, maybe you talk to my boss, he knows more. And, you know, men, they sometimes just call news agencies and invite themselves or up to talk shows and things like that. Women would never do that. So I think for women, if you get asked for media, I think you should really do it, of course, if it fits your expertise and your organization agrees. And also to the men, really help your female colleagues overcome these sort of internal and external barriers. I think it's really important. My experience is that working with media is a collaboration. My experience is that I really had to explain things. So we both wanted to have a good story out there. So we had enough time to prepare, and I could also sort of steer the discussion. And I think a media training is always a good idea. So here's a photo of me celebrating a media prize for women in media that I received at the beginning of the year, and I celebrated with my friends. We had a nice lunch. Yeah, so with this I would like to end my personal story, and I hand over to you, Petronille.
Thank you so much, Alma. I think it's really inspiring. I think for many of us, you're an example, if I may say that. And you gave some really, you gave some advice, but also some very tangible and concrete things that we can do if we also, at some point in our lives, hopefully not through another crisis, but have the opportunity to talk about our passion of public health and bringing key messages across. So Alma actually prepared a couple of poll questions for us. So I will ask our colleagues to pull it up, and then Alma can read it out, and we can see the answers that we get for that. Alma.
Yeah, so the question is, how many of you were proactive in communicating publicly during the pandemic? And the answer is very simple, it's either yes or no. Of course, there are 100 shades of grey, but today we do only yes and no.
Links to something you talked about, that moment when you decided to share your concerns with the media, and then you talked about the Code Black video. And Noemi Boxall says, it sounds as though the hospital staff had to get a bit political by creating the video. How did this feel to you? And she says she's asking this particularly in light of that call to arms that we heard yesterday about how you as a community need to use your voices to provide public health. Did you feel conflicted by having to go out and talk about your concerns in the media to make this video?
Well, I think because it was a joint action really supported by the hospital board, I felt very secure. Because indeed it was a bit of a political act, but it also came from the feeling of completely not understanding how you could have the objective to prevent a thing that was clearly going to happen. And we had the feeling that in the national outbreak management team, but also at politics, that they just didn't know that this was already happening. Yeah. So we really felt that we needed to make it visible. And then we actually also addressed, because I said we addressed the politicians, but we actually also addressed the public. Like, we need all of you to help prevent this from happening. So it was a bit of a cry out. Yeah.
Well, thank you so much, Alma, for sharing your experience. And I will pass the floor to Mircea. Over to you.
Thank you. Excellent presentation from the real life did by Alma. Thank you very much. Your presentation, your great presentation, remind me some previous experiences, my personal experiences in some outbreaks and even the previous pandemic. It was easier 12 years ago than now, but it was in the beginning not so easy, because just several years before we thought about avian influenza, not about swine influenza, and it was, maybe you remember, and all we can remember that time. It's difficult to work with mass media sometimes, and the time could be very, very hard for the family, for the friends, for everybody, and for yourself, for ourselves. And now we would like to invite a person who work in this field as public health communicator, even he's clinician in the same time. So Mihai and Professor, please, your floor.
Hello, everybody. My name is Mihai Craiu, and I'm a pediatrician at the National Institute for Mother and Child Care in Bucharest, Romania. Okay, this is the agenda. I have no conflicts of interests. In times of medical crisis, obviously there is no magic bullet. We cannot address all the fears of the people we are speaking to, of our patients, of the general public, and we should tailor that approach because there is no tool that can work in every country, and there are also different perceptions in different places and regions of one country. So I wanted to discuss with you reasons why things happened like this, and I can anticipate now that at least age-specific issues have to do with media, social media exposure. In Romania, unfortunately, we had 3.3 million confirmed COVID cases, and at least part of this number is attributable to low vaccine uptake by adults in our country. A little bit of context. Prior to pandemic, Romania had the lowest health expenditure in European Union, and since we joined the Union, more than 15,000 doctors left Romania. That's roughly 1/4 of the physicians in my country. And a psychological aspect that has been documented before pandemic was that 3/4 of Romanians confronted with healthcare issues went first to our friend, Dr. Google, and after that to their GP. And revisiting in a recent research published last week that issue, the trends are not favorable. At least 1/4 of Romanians address nowadays in 2022 only Dr. Google. They don't go to their GP. According to WHO UNICEF estimates, national immunization coverage is below herd immunity in our region. And the decrease of, let's give an example, MMR coverage is going below herd immunity threshold for more than 1 decade, according to public data. So it was a chronicle of death foretold. More than 20,000 cases of children in Romania were in the last measles outbreak, and unfortunately 64 kids died. That vaccine hesitancy actually translated to adult immunization programs, and when we had to deal with COVID-19 vaccination, as we can see here in that document from European Commission, Romania had one of the lowest vaccine uptakes for adults, and unfortunately a lot of dead people. Hesitancy is fueled by low literacy levels and also by other neglected determinants like health literacy, as we previously were informed, and low digital literacy. And I want to briefly speak about determinants. Let me introduce you some champions of anti-vax voices in my country. There are TV analysts, bloggers, influencers, unfortunately doctors also, religious groups and legal rights groups, as in all countries. Unfortunately, doctors did a good job in spreading hesitancy. Here is one lady that is a plastic surgeon. Actually, 2 plastic surgeons in our country were sending to Facebook 8 times more information, more content than Dr. Raed Arafat, the head of the National Medical Emergency System in our country. They just filled the void of information at the beginning of a pandemic. Politicians had also their role in spreading hesitancy. And unfortunately, the church and the army are the two most trusted institutions in our country. Politicians are very low in general public trust, but we hoped as doctors that the church will have at least a neutral position. That was not the case. As we can see, these images are during lockdown. Look at the example of the high priests in the images. So I decided several years ago to develop an educational tool in that very specific place where Romanian citizens are looking the information. I was trying to pull my gear up as Dr. Google, and I produced a Facebook page. Virtual Children's Hospital page is a Facebook page, as I said, with more than 250,000 followers and a trimestral reach of 1 million people. 1 in 8 followers, it's not staying in Romania, it's from our diaspora. And what is really very important is that all posts are organic. They are not paid. Even the most important with the most serious reach and most number of comments were without zero money. And that's a solid argument for building trust. Actually, the voice of Virtual Children's Hospital came into attention of the classic media in 2019 when I reluctantly accepted the challenge of the most important private TV company in Romania, and we had a live pro-con debate with the most important influencer and anti-vax blogger. She's a TV analyst, so she knows all the tricks that could have been applied. And you can see on the slides the score of the final voting with more than 1 million votes. I think it's the only one face-to-face encounter when the anti-vax had such a bad outcome. The outcome was that Mrs. Steer closed her Facebook page for more than 1 year. At least that was what I realized at that moment. Now in pandemic, I accepted more than 100 invitations and to record either for radio or for television or for podcasts. 72 of these recordings are still available online. I accepted also the official government request to make a very short recording promoting vaccination, and I even participated to an educational program for media and communicators in Romania and Moldova, our brothers, funded by Sabin Vaccine Institute. In the meantime, I was working, as Professor Popa said, in the emergency department of our hospital, and we published the results of the pediatric impact of COVID, and with my colleagues from WHO Bureau Romania, we generated the country report that reflected the impact on pediatric and mother care and all these non-COVID related access issues. When COVID started going down this spring, and when national authorities decided to stop all restrictions in 9th of March this year, influenza came, and our pediatric wards were really overwhelmed by influenza cases. So I decided to publish what we actually studied 1 year before, when we documented that fear it's a really powerful driver of behavior. Regarding influenza, I posted a very brief questionnaire in Virtual Children's Hospital in January 2020, and slightly less than 40% of the respondents said they were vaccinated previous year. The same questionnaire was published for 3 days online, and we see a massive change of perspective. So we as healthcare workers have a very powerful voice. We can still tell our patients that they need protection when there is a real threat. Then we have a very solid voice. That's me coming back from hospital on the 25th of January 2020, and I was anticipating that print screen, the infodemia term, when it was not present in the literature, and I recommended to my followers to use only trustworthy sources for information. I generated content related to the very high avidity of people for new information in more than 60% of the days of these first 1.5 years of the pandemic. I put a post there, and actually 2/3 of them were COVID related. Most of the posts had a significant reach. Only 3% had less than 50,000 people reach. That means that people were interested in these very short capsules of information. 1/3 of them were related to vaccination. And what had in common all these presentations were that they were really very short, 1-2 minutes reading long, using very simple language in patient language in order to be easy comprehensible and also difficult to be distorted and reinterpreted by malevolent communicators. And I used images. I always associated to the message a powerful image, like the poisonous amanita mushroom that I was associated with the structure of the spike protein, or the story of Optimus Prime from Terminators, if you know the movie for kids, just like the ACE2 receptors activation after fusion. Also, I generated very short videos. One of the most powerful was debunking the myth of brain hypoxia due to masking and face shields and all. I had a live interview of 1 hour wearing mask, face shield, and the pulse oximeter in my finger for the whole hour. And the media said, okay, masking don't produce hypoxia. I used most of the communication related to children and schools, opening and closing schools. I will not cover again the issues that Alma touched, but it was the same feeling that sometimes politicians have a different agenda. In terms of kids, I presented them in the perspective of the community and of their family and grandparents. I discussed about mutations, variants of interest, variants of concern. And a particular aspect of communication in our region is that publication of more than 700 Romanians and Kazakhs, where behavior was analyzed in terms of exposure to a more humoristic approach of the same issue. We have the tendency to joke. Probably it's a legacy from communism. Anyway, joking is good, but not above a certain level, because these people had a more dangerous approach in terms of behavior. In 2022, everybody got tired. And I realized that unsolicited information will go in the junk bin. And I produced a little bit of production, but still it's a significant voice, as we see, and I can prove with an image. That's a post of last week, it's a print screen, regarding the surge of RSV bronchiolitis cases in the whole northern hemisphere. The story was initially taken by CNN Romania, Euronews Romania, and other major posts. That means that still social media is very powerful. And I would like to end up hoping that you will, starting tomorrow when you will go home, to realize that you have a very powerful voice for lay people, even for hesitant people, because you are perceived as experts. And you should, first of all, address fears, not fight with perpetrators of manipulation or fake news or something. They should be debunked, but don't dissipate your energy. Listen to the questions. Try to be a little bit less serious. Don't take it personal. Take a gamification approach. Let's make it simple. And don't forget that social media is an important tool. Thank you.
Thank you. And now is the time to ask Jackie if there are some questions from the audience.
There isn't a specific question to that presentation, but there's a lot of conversation in the chat about experts talking to the media and comms people talking to the media. So, Mihai, it would be very interesting to get your impression. Let me just give you a sense of some of the comments that are coming in, because we've got a great debate going on saying, let me just come back on some of it, and it talks about the importance of these communication skills. But normally, somebody's saying, I felt it was more important to add my weight to the messages that were provided by appropriate speakers rather than speaking myself. Maybe we should have all spoken out. Others said they were restricted in terms of speaking to the media. And so it's very interesting, because I think there's a real debate going on among our audience about whether in some places you're told the comms team are doing it, you can't do it, and in other cases whether you should or whether you should leave it to those who are experts in communications. You did some fantastic tools. How do you see, for people out there who are trying to decide, leave it to the comms experts or I should do it myself, what's your advice?
Briefly, if you don't speak, the void will be filled with a lot of garbage. Yeah, it's definitely, at least in places where trust is the issue, where authorities are regarded as weak or non-acting, it's better to say simple things in simple words and let people decide, to have an informed decision, not just being misled by false assumptions.
Don't leave that vacuum, as you say. Thank you very much.
Yes, an important conclusion from the professor. Thank you very much for your presentation, and the floor is now for John.
Thank you so much. While you were talking, thank you, fantastic talk there, I had word that the poll from Alma is now ready. So if they could please put that on the screen, the results of the poll, that would be nice, and perhaps we should have some reflections on that. Here we are. So, how many of you were proactive in communicating publicly during the pandemic? No, not proactive, 65%. Yes, proactive, 35%. Alma, your thoughts?
Of course, I don't know who are behind the yeses and the nos, but I think this relates to the question that Jackie brought up, so that many people who are in public health having a whole lot of knowledge on the topic were maybe restricted to talk to the public. I expect that to be among the people who responded with no. And I also know in my own surroundings at work that many people would never even dream of doing that. That would be their biggest fear if they would have to do that. So I also expect that to be part of the people who said no. Yeah, and I'm really curious who said yes and how they did that, but of course we cannot really tell that from this
And maybe
chart.
if I can add, maybe some people weren't allowed to also, depending on where you worked, what your position was. You maybe weren't able to use your voice. So maybe that was also a proportion of the people saying
Yeah.
no.
Exactly. If I may, I'm actually a qualitative researcher. This is the sort of question that you need to unpack so in so many respects. Who are the people who said no and why? Would be really fascinating. So thank you so much for that. Now I'm going to move on and I'm going to introduce our colleague Neville Calleja from Malta. Neville is, he works in the Ministry of Health there in health information and has been involved very closely over the pandemic in sitting on the committees and Malta being a very small country, having access to all sorts of actors. And as we were talking at lunch, it's very interesting. In Malta, you're no more than 2 connections away from everybody. And you probably know the name of their dog too. So it's quite a special country. And I think this is what's so fascinating, is that every country has its own unique issues. So Neville, I also should say, Neville has also been very much involved in developing a really fantastic training from WHO on infodemic management. So perhaps you'll tell us a little bit about that too. The floor is yours.
Okay, so I'm not sure if we're going for the poll first or...
Not, I think we'll do that
we'll
towards
do that
the
later.
end. Exactly.
Sure. Okay. So, thanks for the invitation. It's always a bit painful to go after, you know, the other presenters because they've stolen already quite a few punchlines. But it seems like we've been working in the same office. It's fantastic. So, yeah, maybe we can bring up the first slide. Oh, yeah, it's my, okay, my control. Okay. So I'd like to share with you my personal journey, but also the international journey, so to say. So as John was explaining earlier, I got involved to some extent also with WHO in Geneva in developing the strategy and the training and the competency framework, etc., on infodemic management. So it's been, you know, sort of a dual journey, both for myself personally and also I think for WHO itself. And I'll be frank with you, if you're working in public health in Malta, you do everything, okay? So yeah, okay, the main thing I do is health information, but especially as COVID was approaching, it was all hands on deck and everybody was doing everything. And that means I've also had already my fair share of communicating also on media, especially local media, and also liaising with the politicians and the policymakers. As John said, you're never more than 2 people away from anyone you need to contact, and that includes the Prime Minister and the President of the Republic. So, yeah, I'm proud to say I've had a few shouting matches with the Prime Minister himself, but we respect each other a lot for that nowadays. So that's Malta for you. Anyway, so yeah, let's go on. So what we have been faced with, not just during COVID, but I guess it got amplified in COVID. But since the past 5-6 years, we've seen this happen. Like when there was a strange idea, a fringe idea, sort of people did not feel so comfortable expressing it in public, right? Because they were afraid they might be ridiculed. In comes social media, everybody found somebody who thought like him or her, okay? So we basically found fertile ground even for fringe ideas to spread. And I think that's what we were faced with, and maybe as public health professionals, we were too naive to realize it, possibly. Well, that definitely happened to us. So I'll share a story from my country, from Malta. Back in January 2020, so we didn't yet have the first case. we saw this Facebook page coming up. Malta is very Facebook. You know, we don't really do Twitter. It's the nerds at the university who do Twitter. So most people are on Facebook, right? So we saw this page coming up, and it was sharing some very valid information. I said, wow, fantastic, community-driven, you know, public health messaging. We were naive, of course. Soon this started turning nasty, and we started to see a lot of scaremongering on this page. And many of us started trying to sort of debunk, before the word was invented, I guess, what was coming out on this page. And every time we tried to debunk, we were just thrown out of the group, right? And soon it came out that the page had been started by an entrepreneur who wanted to sell face masks. And eventually, the oil reached the surface of the water, as we say in my language. And this guy actually started posting adverts for face masks at 160 euros per face mask. Surgical face masks, by the way, not FFP2s, not even FFP2s. Anyway, luckily, again, public opinion was with us. And I think Mihai made this point earlier, the role of humor. Actually, what helped us a lot was a popular satirical Facebook page that took our side and started picking on the guy. And it's funny, like the whole online community just kind of turned against the guy. So do not discount who your partners could be when communicating public health. That's a very important lesson. Okay, so that led to our own Public Health Association setting up a proper Facebook page. And this, as you can see, was pretty popular. 21,000 members for Malta is not too bad. But let's move on to WHO involvement. So WHO, again, how did I get involved with WHO in Geneva? Basically, I happened to know the people in EpiWin due to a previous life. We were working together in health information in Copenhagen in previous years. And, you know, I started bugging them, like, guys, we need information. We need material to share. Come on, we're small. We depend on you guys. And, you know, they were sort of struggling with this. I think this is familiar to most of you. So that's how this thing started. So as you can see on the slides, first, right away, actually, the strategy was developed. And then we developed that into, I think, a very successful training program that was run already 3 times, training over 1,000 individuals globally. And there's also been some country-specific trainings as well in some countries around the world. So I think it was pretty successful, and it has helped in various ways in various countries. And this brings us also to the point of context. Okay? Context is key when we try to communicate. I'd like to bring up here the example of Brazil. Okay, so I don't need to elaborate much about Brazil. You know, the political alignment in Brazil, at least in the past. But in the north, their main concern was having stuff to eat on the table every day. And that's what they were provided with. And as a result, I think if you follow the political scene in Brazil, you can see that Bolsonaro did very well actually in the north and kept doing well in the north because he was conscious of the context. I will not dwell too much on that. I don't want to go into controversy, but I think it's a splendid example of why context is important and you can't just deliver blunderbuss messaging. Okay, I think in the interest of time, I won't dwell too much on this slide. I think you're familiar with this. The infodemic breeds mistrust in everyone, mistrust in what we propose. It also breeds stigma. So, I mean, my colleagues have shared the kind of abuse they've received online. We've all received abuse online. Whoever of us engaged in communication, both on mainstream media or online, has received abuse. I mean, I like to tell my colleagues, as public health, who went from zero, you know, it's like the cable TV guy. You don't really think about the cable TV guy unless the cable TV stops, you know? And we were there as public health people. We were in the background. So we went literally from zero to hero to Nero. Okay? And that happened within like few months. And I think it has had a toll also on the mental health of some of us, as you're probably aware. And what's also important is that it undermines social cohesion. And as a result, also threatens compliance with measures. I also want to bring to your attention that everybody is susceptible to misinformation, even your politician, even your judge. Okay? These are real parliamentary questions that I received from a medic sitting in Parliament in Malta. And I'm sure you recognize some very popular misinformation. Okay? We also have noted situations where judges in some countries have been quoting a lot of misinformation in their judgments. And this is also hurting public health efforts. So I'd like to move on now to the issue of mandates. Okay, I know we could speak on this for weeks on end, but the lack or inadequate engagement with communication has not helped. And possibly, I would dare say, we can discuss this ad eternum again, that possibly if we had engaged more on communication, we needed less vaccine mandates. Vaccine mandates varied a lot in different countries, as you are aware. So did vaccination rates vary a lot in different countries. This is the situation in January, February. I do apologize to ECDC for not using the vaccine tracker, but I couldn't show past data, or I don't know how to show past data, so that's why I used our word and data. I hid the countries because it's not in our interest to, you know, it's not a race really, but you can see the variation. And I think that justifies also, that kind of explains why vaccine mandates have varied so much from one country to another. Okay? Vaccine mandates have hurt us as well in our professions, okay? And they have definitely made us quite unpopular. And I think it's something that we will have to work on to recover that respect. Okay, I'm sure you've seen lots of these memes and cartoons going around, but let's say we've drawn some horrible comparisons as a result. I'd also like to talk to you about another experience we're going through, and that's court cases. I'm not sure if any of you have been involved in court cases, but we're having floods of court cases from anti-vax, from COVID skeptics, etc., etc. And these are very wasteful. I can tell you, they're very wasteful. I mean, you feel like an idiot trying to defend certain positions in court. So you waste a lot of time, especially if you're a small country like us, you don't have that many public health physicians to spare. We were not experienced on this prior to COVID. I think Italy had some experience, I must admit, due to the mandatory preschool vaccination there, but most of us didn't. Okay? We're also noticing, and I'm not sure if you guys are noticing it as well, but amongst the infodemic management community, I do get this kind of feedback, that anti-vax COVID groups are coalescing and they're sharing witnesses. Okay? Unfortunately, this is not something that we have the luxury to benefit from on the public health side. Okay? We're not getting any international experts from international organizations or otherwise willing to help us giving these, as witnesses. So these are two examples, for example, of international witnesses. I don't want to give names, I don't want to give prominence to anyone. but one of them is an American cardiologist, again linked to QAnon. The other one is a German biologist who has also been linked to Querkinder. I hope I'm saying it right. Okay. Talking science in a court of law is a nightmare. I promise you that. Okay. So judges, lawyers, public opinion is not accustomed to uncertainty. They don't know how to handle uncertainty. It's not easy to communicate uncertainty. Okay, so it's a constant feature of science, of course, we know that. But people out there are not familiar with this kind of thing. Communicating true and false positive rates. People keep missing the wood for the trees. Okay, they just can't see it because they're not trained to see it. Okay, again, disagreement between experts is seen as an argument against an initiative or an incentive rather than healthy and should be encouraged, because that leads to conclusions being reached. But one thing is certain: most judges, most law courts give a lot of weight to guidance and guidelines published by official public health organizations, especially international ones. Okay, so that's a little hint for you. If you're involved in such cases, that's the go-to place. Otherwise, if you present studies, they will present studies, and we go on like this, to infinity. But with guidance, there's respect in courts of law. And that brings us to an issue of responsibility. I know I'm not blaming anyone here. These things happen. But this, for example, has hurt us a lot. The changing advice on face masks. Okay, so I don't want to hurt anyone again, but it is a fact that this has hurt us a lot. Couple of last slides. This is a quote I pinched from a good friend of mine in India. Digitalization is here to stay, and it's not a fashion. It is actually changing our way of life. And he compared it to the Industrial Revolution, and I think he's right. So it's something we have to embrace, not only in communication, but in our life across the board. Okay, we need to build information resilience across sectors. Okay, so, and I'm happy to announce here that the work started in WHO is now spreading to other UN agencies. UNICEF, for example, is actually now engaging a lot in infodemic management, and I believe a lot in the role of education in infodemic management and building information resilience. One last slide from me, and I conclude because my screen says, please wrap up. This is my advice I would tell you from, the kind of run-of-the-mill infodemic management that I have been doing. Never raise your voice when debunking, okay? Do not go to the low levels that your challenger is going to, okay? You're not after him, he's lost. Give up on him, okay? Just give up on him, he's trapped. The people you're after are the silent people reading through the comments on the post. And actually, through debunking, you can reach a lot of people. And I have seen it with my own eyes, inoculation on social media is a thing, and it works. With time, I've seen people copy-paste my posts on other comments, on other posts. So it does work, and it's worth it, okay? So don't give up. Don't feel like, you're a voice in the desert, because the silent majority is reading those comments. Thank you very much.
Thank you very much indeed, Neville. That was a wonderful talk. And I really enjoyed, if I heard it right, from zero to hero to Nero. I just want to be clear that I understood that right. When you talked about Nero, are you talking about as in fiddling while Rome burns?
Roman emperor.
I thought it was a wonderful image. I want to really register that. I think that's a nice way of looking at the trajectory of public health over the course of the pandemic. So thanks for sharing that. Very nice. We have from Neville a poll. I don't know, are we able to put it up? Is it possible? Yep, that would be great. Okay.
Here we go.
So this is a really interesting one. And you have different options here, and you're allowed to answer more than one, okay? So I'll just read it through here. And we're not going to show the results until we close it, so you won't see anything until. We are busy people and would like to find a way to achieve maximum outcome with the least effort. As part of our contribution to addressing health-related misinformation, which of the following would achieve that in your opinion? Now remember, you're welcome to tick more than one option. I believe that's going to be possible within the poll. Setting up a website, setting up a social media channel through which subscribers will be getting the latest evidence based on social media listening, monitoring major social media groups and commenting with evidence and fact checks on any misinformation or disinformation posts, engaging with family doctors and other popular frontline health professionals regularly to ensure that they're abreast with the latest evidence, having senior public health figures or your health minister appear regularly on radio and TV, and suspending the practice license of any healthcare professionals spreading misinformation. So feel free to tick as many as you want, but don't go crazy and tick them all, otherwise it won't have a lot of meaning. So we're going to give you a moment to respond to that, and while you do that, as I say, you won't see anything on the screen until everything's ready. We got a question here, which I thought was a really interesting question, and it's from Sarah Earnshaw Blomqvist. Linking back to the plenary this morning and the importance of building and maintaining trust, how can we join the dots between scientific communication by public health experts and political communication by ministers and politicians? Can any of the speakers give examples of how they have tackled this? I think that's a really important question, because if we're getting essentially different messages, and one of I think it was your point, one message, many voices. How can we do this if the public health people are saying one thing, and in fact we also already know, as you said, there may be dissent even within public health, but the politicians are saying something else? How do we square that circle? Any of you?
So I'll just start and let the others to join. So it does depend on how strong and how trusted the political establishment is in your specific country. I think as Mihai already alluded to this. But what we found hurts most is when you get dissent between ministries, official releases between ministries contradicting each other. For us in Malta, as I said, we tend to be close. So, you know, we had very good communication channels up to the level of the Prime Minister. I wasn't doing that communication mostly. Somebody else whom you might know was doing that. But we had open channels with ministers, and also being respectful. So I'm going to be frank here. Ministers are a bit like, are very proud individuals, right? So nobody has ever been convinced by being called an idiot and, you know, that they don't understand a thing about science or public health. So I think with the right language, with the right communication, with the right coaxing, you can try to communicate to the politician to ensure that the messaging is coherent. Once you lose that coherence, you lose the public. That's for sure.
Alma, any thoughts on that?
Yeah, I think I would like to add, for instance, you could maybe have your own, if I would have something I would like to address, I would maybe have my own communication department line up with the communication department of the National Public Health Institute, or maybe of the ministry, but I think our lines would be more directed to the Public Health Institute in the Netherlands. And what I always did myself was, first of all, to align my messages and my information with colleagues, with the hospital board, maybe with also people from other organizations, to make sure that I really understood things the way others also saw it. And whenever I expressed myself, I thought, okay, would I say this the same way if the Minister of Health would sit here, the head of the National Public Health Unit sit there, and my own hospital board sit there? Well, they were the audience in my head, together with my neighbor, my grandma, and the people I wanted to understand what I was saying. And then I thought, okay, if I would say this in front of them and feel comfortable, then at least I'm coherent to my own professionalism.
It's difficult, though, when you're thinking about having multiple audiences. I mean, having your grandma and the Minister of Health in the same mind, that's quite tricky, isn't it?
sometimes it was challenging, but I think it is more like the level of complexity in your words that is more directed to your, I always had like my neighbor in mind and, you know, the people at school, you know, people I just wanted to understand what I was saying. But I guess I'm also a sort of conflict avoiding person. So I would think, okay, if my hospital board would sit next to me, would I also say this? Or if the Ministry of Health, you know, so that makes you at least polite and respectful.
Yes.
I mean, you can disagree, but I think you really have to remain respectful because at the end of the day, we're all trying to achieve the same. At least that is still my naive understanding of how the world works.
Mihai.
I think a very important thing is to be really curious why that sort of message or reaction has somebody, because I realized that at least communicating in social media is more powerful if you speak less and listen more. The things that finally produce inoculation are coming from listening, not to speaking, and that's why I suggested to take ourselves less seriously, not taking it personal. Yes, we are scientists, but sometimes there are times of uncertainty and things are very fluid and changing, like the face mask issue. We preached something in the beginning and then it changed. So sometimes being more flexible and listening more can help, be helpful.
Thank you. Great. Now it looks like we got some answers here. So maybe you could show us, technical wizards, what we got. Okay. So it looks like the most popular response here was to set up a social media channel through which subscribers will be getting the latest evidence based on social media listening. Neville, does that make sense to you?
Yes. So to be honest with you, first of all, the right answer to this question really depends on your national context, what works in your setting, what works with your people. So there isn't like one correct choice. There is one wrong choice. And luckily it's at the bottom of the list.
Yeah.
Suspending the license. Okay, that is really something we have to avoid as much as possible. Look at Twitter. Okay, why did we reach this stage? Because of censorship. Hopefully it settles down. My daughter is very distressed, actually, that she can't rely on the blue mark anymore. But that's a separate discussion. Setting up a website, again, I'm happy that it doesn't feature well, because to communicate, we have to be where the people are. If you set up a website and nobody knows about it, it's like shouting in the middle of the desert. Okay? So I would definitely support more being where the people are. If the people are on social media, you know, let's be there. I was hoping the second one would come first. For us, we felt this was the best way to communicate public health messaging. We need to ensure that the healthcare professionals, the people out there that our population trusts, has the right information. Now, in our case, those were the family doctors. Family doctors are busy. They don't have time to follow all the blessed research that was coming up per minute. We have to help them with that. We had to help communicate this and keep them up to date. When we did that, we managed to achieve high vaccination rates, high compliance, etc., etc. So I think that would be my feedback, really. But fantastic, we're on the right track.
Really interesting to see that, and I think that's a lovely example. So thanks for your input on that. I'm now going to hand over to Petronille for the final exciting poll. Stay tuned.
So let's hope technology sticks with us for this last poll, because you've heard a lot of advice from our panelists here. We heard messages about using humor, about taking that digitalization is here to stay, and I think that's an important one. So you all are going to play a role, inevitably. It can be a small role or a big role. But how prepared do you feel now after having this session? So we want you to scale from 1 to 10, with 1 being low and 10 being high. How prepared do you feel right now to be a public health communicator?
squeeze in a question while they're answering that?
Yes.
Because everybody, I mean, so many people have voted for a question that was put right at the beginning by Harold Noel about should media training be mandatory for scientists talking to the media? Should you have social media training? Somebody saying comm skills often seen as soft skills, less valued, but this person says it's imperative that they are considered a key competence in EPI training. So many people raised it. I just wanted to throw that in.
Okay, so one of the panelists, what are your thoughts on this education element of communication?
Well, if I can maybe go first. So I think this is not probably for everyone working in public health, I would say. So maybe mandatory is a bit overdoing it. But then, and I also don't want to advocate that everybody raises their voice, because then it becomes a big cacophony of a lot of noise. But I think it should be taken seriously. And I think if you have people who may feel motivated to do this, support them with the training and really help them and be prepared, because you don't know when the moment comes that you are needed out there. So you better be prepared also to do that. And you're not alone, so then you have your communication officers maybe helping you. And I think communication officers are really important to guide this whole process. They can also share the message, but I think in some situations you need your expertise and your knowledge as a person to speak, which I'm not sure, like the previous discussion we had, if only having the comms people doing the work would be the best solution.
Mihai.
Yeah, I think the same. Mandatory, it's a little bit too much. And I want to elaborate on the inverse perspective. If we have some basics of communication, we can actually improve our relationship with media. We in Romania, we had meetings with these media specialists that are covering medicine and healthcare related issues, and we explained them that we are in the same boat, and we asked for their help. And now they are teaching for residents, for very young medical doctors to be communication skills in order not to be afraid when they see a microphone, or it will actually improve the quality of messaging, but be directional.
Neville?
I might disagree a little bit here. I know the word mandatory gives you the shivers, but yes, like hell. It should be only for EPIs. I think for everyone. Only for public health? No. For health? No. Everything, every profession needs communication training. That's what we lack. And even people out there actually need to know how to consume information, because everybody has a personalized communication today. It's not what you get on TV, it's what you get which is personalized according to the information which you're sharing without knowing with all the social media platforms out there. Yes, of course we need such training. And I think, the clear example is, let's look at the UK and the US, two countries that we spoke about this earlier, two countries that I have always respected greatly in terms of their public health output. Let's reflect a little bit on, the outcome of the COVID pandemic in these two countries, and I'll leave it there. I'll just park it there.
Thank you, Neville. All right, let's look at the results from the poll.
Okay.
And we have a score of
6.3,
or is it a 5?
Oh, 5.
A 5.3. Okay, so that means we had some elements that each of us could pick up, but it's still very difficult to say, what is it I need to do now?
I think I would have worried if we got a lot of 10s, because that means you're really not prepared to be a public health communicator.
Yes.
Okay, so I like this result.
I do
because
too.
People out there know that they have limitations. And once you lose that, you get into trouble.
And additionally, what we did is we prepared in the application. You can see a couple of links that you can follow. So don't leave it here. You heard some tips and tricks, but it's up to you also to educate yourself. And this you can do. They're really good websites. They're amazing places where you can get the information and you can give yourself the training to be able to become a good public health communicator. So have a look in the app or approach any of us and we will guide you further. John, back to you.
Thank you. Yes, also just to reiterate that they're great links. Please follow them up. So I've got 3 minutes, literally, and I'm just going to, I've taken notes through this and I'm just going to highlight some of the things that have really jumped out at me over the course of this fascinating hour and a half. I think the first thing that I got was from Alma, which is the importance of support from your closest people who, when you're involved in this, we are all people. We are also vulnerable to online abuse and threats and so on. And so your husband, congratulate him for supporting you too. Please pass that on. I think we also have clearly had a discussion here about the tensions between political messaging and technical messaging. And I think this is something which is going to be a constant battle that we need to deal with. I'm not sure there's a clear answer, but issues about trying to build consistency it's clearly what we need to be doing. One message, more voices. I like that very much, but I am also concerned about who defines what the message should be. And is there necessarily consensus about the message? Because by definition, as we've discussed in a scientific process, you have dissent, you have disagreement. That's good science. So how do we define what that one message should be? Very, very problematic. And I think certainly from my experience sitting within ECDC, the whole face mask question certainly gave me headaches, and I don't think I was the only one. Very interesting what you mentioned about the army, trust in the army in Romania. This is something I remember last year when we were discussing about the vaccinations and the whole issue in Romania specifically about how we can engage with different organizations to promote vaccination. This is something that took me by surprise. I would never have expected that an organization such as the army in a country would be such a trusted group as to be someone we should be listening to regarding vaccination. What's the message from that? Prepare to be surprised about who may be on your side and who may be a really good messenger. So I think that was a very interesting point. Also, when you talked about the face-to-face encounters with the so-called anti-vax lady on the TV, fascinating, and I congratulate you for the success, but very high risk. So this is something we need to be careful about. Going on public, on the air, and engaging with someone like that could backfire seriously. But as you said, if you don't speak, if we don't speak, the void will be filled with garbage. That's a good one. Remember that. And then finally, a point from Neville. We're in a new era. Digitalization is the equivalent of the Industrial Revolution. Things will never be the same again. So let's get used to it. Thank you very much indeed.
Thank you very much indeed. Thank you to all of you. Great moderation, great speakers, great questions from all of you.